Thank you.
Thank you. Thank you, Prof. One of the Prof I respect so much. Thank you for your introduction. I also want to thank Kudus for inviting me too, and also keeping on track on my presentation. Let me share the slide.
I'm muted, Prof, but do you want us to share the slide? I can share it for you if you want me to share. And you just tell me
Okay,
to.
please share for me, please.
Okay, and you just tell me to do it.
If it's possible for you.
Okay. There you are, Prof. You just tell me to move on. To move to the next.
Bread where I chop yesterday, maybe like. Which bread?
Good morning, all. So today's topic is on writing methodology section of systematic review and meta-analysis.
You see, I bread. If I don't.
This topic is very when I teach systematic review, after the method, then when we teach how to write proposal, we teach how to conduct systematic review. But sometimes we lay less emphasis on writing it when you have finished the work now, how to write it, the methodology aspect, because it's very important. And if you don't make it, write it well, it will be rejected by the reviewers. So today we'll be talking about those nitty-gritties on this area. So that is the next slide, please. So I just brought this symbol to encourage us. The speaker, me, is a member of Cochrane. Membership, I think, is every 5 years. I'm seeing my own. So I encourage who are listening to try to continue the systematic review process. Try to be a member of Cochrane. This will involve you doing one of the Cochrane systematic review. This day we have a lot of review groups, method groups one can join, and then continue. Next slide, please. So these are our learning objectives. You're going to learn about the items needed in method section, things that are compulsory you need to put when you are writing the method section of your manuscript. And then we're going to talk about the points needed in each subheading. Then we also know that when I was preparing this section, I also noted that in the abstract, though I think it should also be given by someone, but I have to bring it in here because abstract also has a method section on it. So I have brought in abstract, how we can also write a method section of the abstract, or is abstract in the entirety. What are, depending on the journal you are submitting, they can limit the amount of words. But despite that, I see some content that should be there. So I'm going to discuss about it too, the method section of the abstract. Then we want to talk about Prisma 2010 checklist. Although we're talking about, people are talking about Prisma 2025. I think you see what you have is out now is Consort 2025 checklist. But 2025 will still be out. But I'll use the 2010 for this lecture. So it's also important because anytime you want to publish a manuscript, send to a journal, some of these big journals, Q1 journals, as Prof usually say, Prof. Morenike, he will always say Q1, Q2. So they will always say, where is their checklist? Like if I want to submit in Lancet, they will ask you about your checklist. So we're going to talk about it briefly also in this lecture on method aspects, how we're going to put it and the page number, and we'll round off. Next slide. So the method section should describe the literature search, specifically the database used, and if the search was restricted in any way. The selection process for the articles, quality assessment, methods of data abstraction, and synthesis. This is just the summary of what we're going to talk about. The literature search, specifically the databases used. Then, if the search was restricted in any way, this is very important. These are the most salient. Anytime we're writing it, this must be there. This component must be there. Selection process for the articles, quality assessment, method of data extraction or abstraction or extraction, and then how did you synthesize? How did you do analysis? What software did you use? What and what? What are the bases? These are things that must be there in the method section. Next slide. So the other is the, let's start from search strategy and selection criteria. Usually when you're writing a systematic review under the method section, you can write a design actually, but the first thing usually is the search strategy and selection criteria. So you have to start with a study descriptor. Then the first thing will be, is it a systematic review only? Or does it include a meta-analysis? In a systematic review only, it means assessment of heterogeneous trials with no summary estimate. I know some of you should know the reason. Sometimes if you are doing a systematic review and meta-analysis, you may end up only doing a systematic review without a meta-analysis. So you have to start by describing what you are going to publish. Is it a systematic review only, or does it also include a meta-analysis with an overall summary estimate from available data? That should be the first thing that you should describe. Sometimes you can write it under one separate heading, study design. You understand? But that is important. Then that's the first thing you consider. Next slide. Sorry, I don't know whether you can see this, but I just gave I copied this from, sorry for if you are not seeing it. Can you see what is on the slide? Can you?
Yes, please. Yes, please.
If you can, I know some of you, if you can enlarge it, you can see. But I just tried to tell you, this is the published paper, the method section. You can now see what I'm trying to describe. So if you enlarge it, I have to insert that published paper, the method. You see, the present systematic review was registered in Prospero. We'll come to that. This is how they started their own. And it's designed according to preferred reporting item for systematic review and meta-analysis. That is Prisma. That is the full meaning of Prisma. That is the full meaning, guideline. We're going to talk about it briefly before I finish my lecture. The review is based in aggregated data that have been already published in international literature. Patient consent and institutional review board approval were therefore waived. So what am I trying to say? It also journals varies. There's some ingredients. Journals varies, but this is how they started. They presented a systematic review. You understand? So you don't get if you're conducting a systematic review, it doesn't require ethical approval. All of us know. What you just require is registration in Prospero. So when some journal will tell you to make a comment on ethical approval, just say that it's not necessary or not applicable. They can tell you what are the reasons. The reason is that it's the secondary data you are using. You're not contacting the patient directly. So that is the point you give. All depends on the journal you are publishing. Sometime. So that is this on the next slide, please. Now, the other thing we need to discuss under method 7 is what were the criteria for the study inclusion. This is the question you have to answer after the searching and the study design. So you have to list study dates, the language requirements, population assessed, and study design. Example, only study design I mean here is the study design that that is the inclusion criteria. The study design you're going to include in the meta-analysis, not the study design of the, the study design is already systematic meta-analysis, but the study design I mentioned here is the study design of the studies you are going to include. You know, sometimes I have somebody who will be writing a systematic review and is including a review article. No, you cannot include a review articles or editorial when you're conducting a systematic review. But if you want to include it, then you have to put it priori. That's why you have to publish in Prospero. But most likely, most generally, we don't include those. So you have to specify the design of the study you're going to include. Sometimes, especially in Cochrane review, we don't include observational studies. What we normally include is only randomized control trial. But everything depends on your title, what you are working on. Like some of you are working on observational study. So you're going to include observational study. So study design is example only randomized control trial or the types of observational studies you're going to include. Sometimes you might include only cross-sectional study and cohort study, even without including case control, because maybe you're working on a work that a title that requires prevalence, and you know that you may not be able to get a prevalence in case control study. You can only get it in cross-sectional study and perhaps cohort studies. So you might decide not to include a case control. So it's you as author that will decide whatever you want to do. So you must include it under criteria for study inclusion. But sometimes I notice that some people are not thorough on this. Language is important. Were there any language restriction in what you did? Are you only including journals in English or English and French? Like some of you who work in this Africa, it should be good. I think I read some people in East Africa or some, they included those in articles in French. And even if they don't know how to speak French, they have to get a French author, at least 2 of them, who can now interpret the French articles. That is what is required. Again, if you're only including language, and let me not go into that extent, but I'm just describing what you're going to write in where you're publishing non-method section. Let me not go into more details like that. This one shall be, we have discussed it in the other workshop we did earlier. Now, state any study exclusion criteria and reason. You have to, if there's exclusion criteria, state it and give reason. Example could be abstract. If there's an article, if the study is only seen in abstract only, you might decide to say those ones should be excluded. You understand? Or if there is articles published as editorial or as review article, you're going to exclude them because they don't contain the data you need. Next slide. So this is also another area I have highlighted under this published work: eligibility criteria, information sources, and search strategy. You know, they merge those other ones we discussed under this. So the eligibility criteria for the inclusion of studies were predetermined. All studies that examine the impact of loss on survivor outcome of patients with endometrial cancer were considered eligible for inclusion. All histology groups were considered eligible for inclusion. However, a decision to proceed with subgroup analysis were taken as subgroup item for low-grade endometrial tumor, and other tumors were available. The molecular classification was not considered for the purpose of the present systematic review due to the limited amount of data. So those things should be stated. If you're making exclusion, state the reason where you are making the exclusion. For instance, you might say, okay, you're only going to include only study that reported women that have endometrial cancer that was histologically confirmed. So this should be stated clearly under meta-analysis. So the inclusion criteria should be clear, which you use, so that, because the systematic review should be transparent, so that any person who wants to reproduce the work later, maybe after 10 years, to update it, it should be clear to the person to follow the same method you have used, and you should arrive at the same result. Next slide, please. Now, describe the data sources as first. List databases, searched, and exact date cutoffs. Very important. You have to state the database you have accessed in the work, like PubMed, Hinari, Scopus, Embase. You have to state the date where the thing were. You have to state, if you say, like the one, I think that of East Africa, the one I read, we reviewed recently. You have to specify, is it from inception to date, or is it from 2000 to date? Everything should be clear. Sometimes you might have done the search, let's say in January 2025, and have been working on it. So you should specify the day the last search was done. You understand? So you must writing to date is not acceptable. You must state exactly the date you do the search, so that everybody knows the recency of the work. You know that if let me give us information. If you are writing a manuscript on systematic review, generally the search should not be more than 6 months or 1 year. So let me give you an example. If you submitted a work, we're in July. Some of you are working on systematic review and you submitted it this July. If by, sometimes journal can be crazy. You might send it, they reject it. You send another journal. You keep on monitoring. Before you know it, 2006 have arrived. They are still with it. It shall reach June next year. They have not yet published it. By July next year, the thing comes out under review. Do you know what will happen? They will tell you to update your search because it's already up to 1 year, 12 months. You have done your last search. So the reviewers will now ask you just quickly do a search between July 2025 and 2026 to know whether there's any other paper who have been added. And if you do a search, if there is one, you add it, just put it in the software. It's not to generate the data again. It will not change. Just if the data change, just put it and it makes it recent. So that is how a systematic review should be done. So always state its date, because that will help reviewers to know their judgment. Even people reading it will know to know their judgment or what happened during the time you are conducting the work. You have to provide search terms used for at least one database so that the research could be repeated. But sometimes you can also put it under appendix or the search terms or search strategy. You have to put it under appendix. You can, for instance, if you have done on PubMed, Scopus, and let's say Embase, you may have all those search terms or search strategy. So if you have search terms, you can state them. Usually some journals would like you to state the search terms, at least for one database. Sometimes they may not require you to state other ones. But if you state it in detail and put it on the appendix, it's still acceptable. So there are two ways to it. How thorough was the search? Example, study authors were contacted, gray literature sources assessed. Like most of you did well in the one you did recently. You assessed the gray literature. Some of you went to postgraduate colleges. So that's commendable. And articles translated. You must be thorough. You have to state those things. Whether gray literature, because sometimes you might see an article online. You don't have available as abstract, and they're necessary to be included. You need to do is to contact the authors. Or sometimes there may be information you are looking for. You know that you may do a study, and some authors may do a study, and due to the journal requirement, they may not include every detail in the published work. But peradventure, you are doing a systematic review, and you have seen that you have read the work, the primary study, and you felt that it is eligible for inclusion. The only problem is that the data you need is not there. Maybe like now we worked on under 6. But the article published for everybody from 1 to 16 years. So you can contact the authors to ask them, can they give you data for only 1 to 6 months, 1 to 6 years? Because from the one they published, they brought everything together. So if doctors can reply you and give you the one for 1 to 6 years in confidence, you include it in the work. Otherwise, you can just include the work, but you can't involve them in the meta-analysis. So this is an example of what I'm talking about here. You can say they have contacted the authors, but they did not reply. 2 times they didn't reply, or they replied. The grades just were sourced and it was not seen, or it was seen. Articles were in French and it was translated. We got 2 articles in French or in Chinese, and they were translated. So this thing should be stated in the methodology section. Next slide. Now, another thing we need to consider is, did you search trial registries and seek data from any unpublished studies identified? That's an advantage of trial registry. Like if some of us who are publishing randomized control trials, for you to publish a randomized control trial, you must register it in a Pan-African clinical trial registry or clinicaltrial.gov or .gov, depending on the country you are located. So in this case, it will contain the ongoing studies which have not been completed. So that's the essence of searching for registries. You can see ongoing studies. Like I have been contacted severally. By those doing systematic review, because there are a lot of work to have registered. Sometimes we may not have published it. Sometimes it takes up to 5 years before you publish an RCT. Sometimes you might even have finished the work, but the thing is being rigmaroling one journal to the other. But the authors needed information immediately. They can contact us. So you have to search strategies and seek data from any unpublished studies identified. Sometimes if you have an ongoing study, you put it as part of your article to include, but you put it an ongoing. Sometimes it may be a trial that is unclassified. What we call unclassified. Unclassified means that you don't have the information. You have seen that the trial has been registered. It looks to it qualified for inclusion, but you cannot classify it in the sense that the work have not they don't have the data, or couldn't access the authors. Authors did not reply, so you cannot classify whether to include it or not, because it's only when you read the full work that you cannot decide whether to include it in meta-analysis or not. Now, what level of data was sought? Individual patient data, level data, or summary estimates. So this also, I've already mentioned it. You know that these days, people are talking about individual data, patient data meta-analysis. That is what is on vogue now. People are saying that, depending on the work you are doing, it may be preferred than the one already summary estimate. They feel that individual data will be raw data, and then you conduct a systematic review on it. So you have to specify the level. Is it individual data or from the one published summary estimate? Most times it's summary estimate that we use, and not individual patient data level meta-analysis. So those things should be stated clearly on the method section. Next slide. Who did the searches, screening of studies, and data extraction, and how were conflict over inclusion resolved? These details must be there on the method section. Usually, the teaching is that screening should be done at least 2 persons. If there's done a screening and there's conflict, a third reviewer will resolve it, or you discuss. The 2 people will discuss among themselves. The same thing with data extraction. At least 2 persons will do data extraction. So you have to, and state the name of the people. You can use the initial of the authors. Like my name is George Uchenna Eleja. You can use GUE. You mustn't state the full name. People know that if you want to use initial, it's a different, and did the 2 of them did it. So you use the initial for them. And the third author resolve the conflict. Describe criteria for inclusion in the systematic review and also for inclusion in the meta-analysis. Now, if different, sometimes the criteria for inclusion in meta-analysis may be different. So, for instance, you may, that the review, like the one they did, the other South Africa did or not, they did, they may have gotten 10 papers for systematic review. But out of that 10 papers, they did not include only 8 in the meta-analysis. So you have to state the criteria for including the meta-analysis. If there is a useful data, then include it. So all these things should then also provide a link to the study protocol if available online. You know, sometimes it's also advisable to publish a protocol. That is, if you register it in Prospero, you went ahead and publish it in a journal. I know some of you have not done that, but it's also good to publish your protocol. It's a way of also adding to scientific knowledge, and it also counts for you. Sometimes they publish it in a Q1 journal, and you have 2 papers in one. So you publish the protocol and publish the systematic review. So if I publish the protocol, but if you got a grant, usually most of the time if you get a grant to conduct a systematic review, I think it's advisable to publish the study protocol so that you acknowledge the people who gave you the money. Then when you publish the work, you also the review fully. You also acknowledge them. So if it's available online, you have to put the link that the protocol is this. So most journals respect it a lot. Lancet, but if you have published it, it means that you are very transparent. You're not going to go back. So if you say something different, people will now perforate you, say, but you say you are going to include it, but now what you wrote, probably you're saying is different. So it's more transparent if you publish a protocol. But most of you are always in a hurry to do things. So it's good to be in a hurry to be fast, but it's also good to relax and do the right thing. So if you're not too in a hurry, maybe you are using it for your PhD, you can publish the protocol if it's allowable by your institution, or if you're doing a grant, I have said example. So if I publish, you have to give a link. It strengthens your manuscript that you are sure of what you are saying, and you're not changing. Because once you publish, you can't change. If you want to change, then it becomes you have to downgrade the outcome. That outcome can be downgraded. Whatever you are doing, it can be high again. That is one of the consequences of it. Next slide. This is just a sample of that published paper on study selection. Retrieved studies were selected in 3 consecutive stages. The first step involved deduplication of retrieved article, which was followed by manual screening of titles and abstracts of all electronic articles that remained by the 2 authors. You have seen the link. The mention the name of that is the initial of those 2 authors to evaluate their eligibility. Finally, studies that were considered potentially eligible were selected for inclusion following retrieval and review of all full text. Discrepancies that arose in the later stage were resolved by consensus from all authors. So anything you did, state it clear. If it's resolved by everybody, so it should be it. You report it. If it's resolved by a 3rd author, state so. If a discrepancy is resolved by the 2 people meeting together, that's consensus now. You say it states so. So that everything should be transparent in the paper you're publishing. Next slide. Now, data analysis. You have to describe the method of data extraction and method of dealing with duplicate data. What I read in the last slide. So first of all, if there's duplicate publication or duplicate data, I think I discussed it last time in the workshop, how to handle that. So I'm not going to talk about it in detail now because it's handled by another workshop, how to handle duplicate and how to identify it. I'll give you an example last time, but some people like me, that they work like this by October, I'll be in South Africa for FIGO conference to present an RCT. So we have not yet published the main work. So people will now see it and include it maybe by November, they will see it online. And by December, we'll publish the full work. So by January, they're doing a systematic review, they will get the 2 work. So it's a duplicate publication already. So now they look, the other one is abstract, the other one is main work. So if you, maybe in the one we did in South Africa, my name was the lead author. But the one we published, it becomes maybe Morenika is now the lead author. So sometimes some people who are not careful will think that they are two different papers. No, they are not. To know that they're not too different, you look at the registered, the trial number, the register, you find that they will be the same. The authors may not even be the same. The other authors may not be the same, but the registration, and look at the number of people that were recruited in the work. If it is 2,000, the same work, probably work is 2,000, then that will tell you that this is a duplicate data, that you're going to include only one, because even though that the authors authoring is different, that does not make it a 2 paper. So we need to be very careful on that. So you must describe how you dealt with duplicate data and give details of the primary outcome and the measures of effect, like risk ratio, confidence interval, and list all pre-planned secondary outcome measures. Detail of any adverse event assessment. So it depends on the topic. Actually, each of adverse events depend on the type of review you are doing. Usually, if you are doing intervention reviews, yes, adverse event must be there. But if you are doing observational study, you will limit yourself to primary and secondary outcomes only. I hope you understand me. Can you hear me? I think people are getting what I'm saying.
Yes, we can. Thank you very much, sir.
Okay, next slide. Next slide, okay. You also describe how you assess the risk of bias in the included studies. Risk of bias, very important. Were sensitivity analysis done? And like one we read recently, they did risk of bias assessment, good, very good, but they didn't do sensitivity analysis. Again, were sensitivity analysis done after exclusion of studies at high risk of bias? That's the question they're asking you. Usually, we don't, if after doing risk of bias assessment, if a work have high risk of bias, that study will be excluded for meta-analysis, but not for sensitivity analysis. So the question now asks, were sensitivity analysis done? Yes or no? Yes, it was done. Maybe leave out one sensitivity analysis. You remove one trial and check the outcome. Does it change the different? Take only one article at a time, and not to take more than one. No, the teaching is to take one at a time. Take one, replace. Take one, check the effect size, record it, replace, and take another one until you finish all the work, all the articles you have included. But the question now, where the social analysis is done after exclusion of studies at high risk of bias. So that's the answer. So whether you have excluded the study with high risk of bias or not excluded it, social analysis should be done. But generally, what we normally do is if there's high risk of bias study, we normally don't include them in meta-analysis. But when you're doing a sensitivity analysis, they may be there. But if you want to decide to exclude them and now conduct sensitive analysis in the remaining ones, these are the things you should describe in the method section. That's what we're asking here. So whether the only one you did, be clear about it, state it clear in the method section. Next slide. So this is an example of assessment for risk of bias. How you write it. You say the methodological quality of included observational studies was performed by 2 authors, MF and VP, using the Newcastle-Ottawa score that assess the trial risk of bias in observational studies by evaluating the selection of the study groups. Maximum rating, 4 points. The compatibility of the groups, maximum rating, 2 points for comparable histological subtype, and another 1 for the actual stage of the disease at pathology analysis, and the outcome of interest, which was predefined in a minimum of 3 years median follow-up, indicated either by the author or by the interval of greater than 3 years between the last patient recruitment and publication of the article. Maximum rating 3 points. So the point is that what they use here is the Newcastle or Tower scale, but there are a lot of scale used for risk of bias assessment. You understand? So you mustn't use Newcastle. You can use Hoy and colleague. You can use the lot of Cochrane risk of bias too. You can use Robbins 1 or Robbins 2. There are a lot of, any one that is you are familiar with, you can now use it. But you have to state how as each one was assessed, how the points were arrived at briefly. If there are 9 parameters, you state that there are 9 parameters and say that this is this, score of this is 0, this and this. Just give details on how to assess the risk of bias. You have to state them in the methodology aspect, because, and you have to cite a reference to the one you have been using so that people can also check that what you said is correct. So always cite a reference in some of the things you mentioned in method section. Some of you think that you only cite references in introduction and discussion. No. There are some references that should be cited in the method section, and some journal will require, like this PRISMA checklist, PRISMA guideline, you must cite it. The tool you use for risk of bias, you must cite it. And 2 other things you can cite. Next slide. Now, another thing you mentioned in the method section is you have to define all variables for which data were extracted. Example, number of patients, age, sex, vaccination status, outcome data, and any summary measures used, amalgamation of age groups. So you have to define all variables that you assessed in the work. You have to describe methods used to assess the variability within the studies, between the studies. Example, I-square estimate of heterogeneity and how studies were combined. You understand? So if there's anything, like now, I'm talking about age group amalgamation, but most times we don't normally do it in a schematic frame, this amalgamation thing. But sometimes it may be, depending on what you are doing. So everything depends on the topic, what you're assessing. For instance, some of you who did on the ECC, we are talking about less than under 6. We see a study that published under 1 and published also between 1 and 5. But you're interested in under 6. And that's what they published, the authors published. So you can add, if they have the data for under 1 and between 1 and 6 years, what you now do is to add them for that study, for you to include them, because what you need is 1 to 5. But you see one study that published, the number of people that have ECC under 1 and let's say is 50. Then between 1 and 5 years is 40. So you have to add it to get the thing. So you have to state so. We also check for heterogeneity and so. So you have to report the heterogeneity, how you estimated it. Next slide. Was a fixed effect or random effect model used for the meta-analysis? You have to state so. State the statistical package and version number used for analysis. Some of you will use R, some will use Stata. Some of us also use RevMan 5.3.4. So you have to state the versions of any statistical package you used. These are under the method section. You have to state whether you use random effect model or fixed effect model or both. List study registration number and name of registry if available. I think I've mentioned this one before. Next slide. The role of this one. So this one may not be in the body of the method section. This one can be under, the role of funding source. Sometimes you can put it under method, depending on if you are working, some people are working on drugs. You have to put it. But if it's not compulsory, this one can be put under before reference, but after conclusion. The role of funding source. Include standard statement If funder had no role in study or amend as necessary, the funder of the study had no role in the study design, data collection, data analysis, data interpretation, or writing of the report. What I mean is that you may have gotten a grant to conduct a systematic review. Do you understand? So here you have to declare it that the funder did not have a role in the, because it may, like the one we did last time on Oral Quick with Morenike and Fola on Oral Quick. So we got some funding on it. And both the funders are interested on the outcome. So we quickly declared that we only got money. They didn't influence us in terms of the design, data collection, data analysis, interpretation, because some people might go behind and they give you money to do a research and give you money to write favorable, because once you write a favorable report, people will start using their product. It happens a lot of time in industry. So during I think COVID-19, we had a lot of things like that. Some studies, some publications were retracted, even in big journals. So a lot of scandals, some of this. So it's very good to authors to declare the role of the funding source. If the study had no funder, you state that there was no funding source for this study, and everybody will go and sleep. So, was it that the funder? If that the funder you don't declare it, it's also a sin. It's a problem. It's a litigation issue in literature. You must declare everything. It's a very serious thing, and you just state it. Sometimes some authors of the article are the funder themselves. If the authors are in funder themselves, then what you need to do is that author, who is, maybe we ask whether he has a share with the company, or if the wife is maybe one of the authors, the author is not working in the company or human for that drug, but the wife of that author is maybe the CEO of that company. So, Source Journal will tell you to declare all those things. You have to declare it. Again, so sometimes they might give you some money to travel for conference to present this paper. So you also need to declare, but there's a minimum. If the money is more than, I think more than $5,000, you need to declare it. But if it's less, they might say no need because the money is small. So it depends on journal, and it also depends on the authors. So you need to do something. Next slide, please. So here is just part of the reporting. From what I've said so far, we have title, abstract, introduction, method. We're concentrating on method today. Some other people will talk about result and discussion and others. So abstract is important. Go to the next slide. Next. So in abstract method session, you have to study state study design, semantic review, meta-analysis, or semantic review and meta-analysis. Next slide. Indicate the data sources assessed, including the exact search date cutoff. I've said this before. Indicate the specified criteria for studies inclusion, including participant eligibility criteria. I think I've said all these things. My next point. Next slide. State principal study exclusion criteria, reasons, describe method of data appraisal and extraction, who did this. So those things we mentioned earlier should also be put in the abstract, but in a summary way. When the reader patient data requested from the study authors, or where summary data extracted from the published report. Next slide. What was the main outcome assessed, and what statistical method was used? We do not, as standard, include additional outcomes in the summary. Briefly summarize adverse events and provide the study registration number. It's also important to add the postpodal number in the abstract. Please remember to add it. Next. Okay, next. Next slide. Next. Next. So this one here, to round off what I'm saying today, this is writing the methodology section of a semantic review manuscript, step-by-step guide based on Prisma 2020 guideline. Next slide. So the criteria specify the inclusion and exclusion criteria for the review and how studies were grouped for the synthesis. Next slide. Specify all databases, registers, websites, organizations, reference lists, and other sources searched or consulted. Include the date or last searched. So what I'm saying here is that in the Prisma checklist, which we are submitting when we are submitting for the journal, you must state the page in your manuscript where this information were listed in your manuscript. So you must page your manuscript. You must know how to page your manuscript, even numbering of each item. There's a line numbering and page numbering. So we should know it. And then state in the manuscript page where each of these items are called. So I'm just revising it for you to have idea that these information are important. Next. Present full research strategies for all sources, including filters and limits used. Next. Specify methods for deciding inclusion, number of reviewers per record or report, independence, and automation tools, if any. Next. Describe how data were collected, reviewers involved, independence confirmation processes, and automation tools. Next. This is an example of automation tools, depending. If you do the data automation tools. For instance, in screening of study, RIAN, I don't know if you know about CIAN, data extraction, confidence, these are automation tools. Do you understand? In searching, we have epistemonics and PubMed or Medline apps. Some of them have AIs that can help you to do all these things. Next slide. These are all automation tools. Next. You have to define all outcomes for which data we are sought. List all the other variables and assumptions for missing or unclear info. Next. Specify methods, tools used for reviewer, roles, and independence. Mention automation tools if used. I've mentioned example of automation tools. So independence means that each reviewer should do it independently. It shouldn't be, you do your own, that person do his own. You now come and report. And if the difference, discrepancy, you either discuss or call somebody who will not be a tiebreaker. Simple. So at least two persons must do each role in a systematic review. It's not a one-man business. It's not a one-man business. Next slide. Specify the effect measure used, risk ratio, mean difference. Next. Describe synthesis eligibility, data preparation, tabulation, synthesis methods, heterogeneity, assessment, sensitivity analysis. Next. Describe method used to assess risk of bias due to missing results. Population bias. I ordered this one. If included bias primary outcome of interest is up to 10, you have to do a population bias assessment. Next, and you have to report it. Describe methods to assess certainty of evidence and summary of findings. This one is not for every semantic review and meta-analysis. It is for intervention, or if there is a semantic review that involved comparisons, maybe comparative studies, then you have to do certainty of evidence. But if it's only for observational prevalence studies, which some of you are doing, it's not required to do certainty of evidence assessment or summary of findings table. He has his own software. What we call it is grade assessment. Grade. Next. Questions. Next. Thank you. So conclusion is, if you have questions, you can ask now. So
thank you very much. Thank you. Let's show appreciation. If you have emojis, just share it. We have 10 minutes, and I open up the space for questions, and I'll explain the next steps after that. Any question? If you have your hands up.
On the chat box.
Okay. All right. No. So there are questions.
Not the question, actually.
Or copy of presentation. All right. Thank you, Professor Eleje. Thank you very much. One of the things I'd like to encourage listeners is that, yes, this might seem strange, but it is very important to know that the what's it? The details that go into systematic review, which is one of the top most level of evidence. For APIN researchers, we do a lot of implementation research and nursing and pulling the evidence from your implementation research might be the path you want to go in generating evidence from the work that is in the field. I can assure you that there's very little systematic review and meta-analysis of our work in the country, limiting the ability to generalize many of the findings. Implementation research also has its challenges with respect to generalizability, but when you do systematic review, at least you can kind of start to tell us what it means to scale these things up to other parts of the country. It's a whole science of itself, a completely whole science, just like implementation science is a science in itself. But this is somewhere, if you're wanting to work in this field, you might be thinking of growing your competence. Once again, I opened up the space for questions. Let me see the chat box again. You have a question, Prof, from Dr. Emmanuel Ojo, who says, please, what is the meaning of soft under certainty assessments? What is the meaning of soft under certainty assessments?
Okay. Yes, soft means summary of findings tables. Summary of findings table. As I said, it is normally required if you are conducting a meta-analysis on interventions, or you're conducting a meta-analysis of operational studies that have comparative studies, maybe case control or cohort studies that have control, that have you are comparing two things. Then you're required to do a summary of findings table. It is used for, it's a summary, a table, one table, or like that summarizes everything. You may have a summary review that have 100 pages, but that table should summarize everything, all the 100 pages. So, and that's what policymakers use. If you want to talk to policymakers, governors, politicians, it is that table that you use to explain everything about what you have done in a systematic review. Some of you may not have had that experience, but as we continue to in this process, one day we'll have a workshop on it and you learn it. Thank you.
Thank you so much. And thanks always for your time. You have a second question. Says, in a case where there is a disagreement between the risk of bias analysis and sensitivity analysis, how can this be resolved? And what steps can be taken? Over.
Yes, as I mentioned earlier in the discussion during my workshop, there are options you can do, and they're all allowable. For instance, you can, two of you can discuss. You call him on phone, or you come together. You reason together. That is, two of you do reason. This thing is like this. How do you see it? Just like this is like this. How do you see it? You find out that the other, maybe the other person did not understand it the other way. But when the two of you are discussing about it, how you understand that paper, and how the other person, end of the day, you now come to a conclusion. That's one aspect. The other aspect is to give it to a third person, maybe usually a senior person, a senior author, because when people have that, when you consider using a tie break, but if they say that two heads are better than one, but they have corrected out and say that two good heads are better than one. So if you are going to give it a third person who is a JJC, who doesn't know anything about systematic review, the thing is like, if the outcome. So usually, if you need a third person, it is preferred that that third person may be a senior person, a person who have a knowledge, who will be a tiebreaker, a stable tiebreaker, and then you involve the person, and the thing will be resolved. Once the person say this is it, then you take it that way because it's a respected person. But you won't give it to somebody, a third person who is a JJC. The person may even add more confusion to the whole thing. So you better even discuss, two of you discuss who are good heads, two good heads discuss, than to give it to a third person who doesn't know anything about systematic review or who doesn't know the methodology aspect we are talking about. And I'll give you information because these are in-house things we do among ourselves to ensure that we get a quality manuscript. Hmm?
Thank you.
So
Thank you very much. Yes, I think we have 4 minutes. What I'm going to ask, I think what the person is asking is about disagreement in the outcome of two analyses. So you do a risk of bias analysis, and it's not being confirmed by the sensitivity analysis. I didn't actually understand that, but I think that's what this person is saying. In that case, when the outcome of your risk of bias assessment is not speaking to your sensitivity analysis assessment, how can this be resolved, and what step can be taken? Over.
Okay, the two things are different. Sensitivity analysis is a different thing altogether. It's different from risk of bias assessment. Risk of bias assessment is somehow subjective. Sensitivity analysis is not subjective. It's objective. It's a software that will give you whatever is garbage in, garbage out. Whatever you put in just like data analysis, whatever you put there is objective, whatever it gives you. So it is risk of bias assessment that is more subjective, because the way I see something, just like if you go exam, medical exam, you are doing an OSCE, somebody is scoring, another person is scoring. Maybe a candidate you're performing. So the way you see the other person, it may be different from the other way the other person sees it. You're assessing the risk of bias based on. So even though there's a criteria, but sometimes that the way you misunderstand the criteria. So risk of bias assessment is different from sensitivity analysis. It is risk of bias assessment that is where we have controversy. We don't normally have controversy in sensitivity analysis. I think my comments are clear now.
Excellent. Thank you so much. There's a last question. I'll just answer it. Justin asking, thank you so much, Prof. In duplication paper and abstract, each an abstract and a full manuscript from the same author. If the manuscript had an improved and updated data more than the abstract, but someone has used the abstract in their systematic review before the manuscript was published, does it have an effect? I'll just quickly answer that. That's actually for a good quality systematic review, you would not have used your abstract, because in the absence of a full manuscript, you cannot have done a risk of bias assessment. And you have to do a risk of bias assessment to be able to identify which manuscript you will be taking forward in your meta-analysis. I think that's a limitation if anybody decides to use the abstract in the person's systematic review. I think so. Over to you, Professor Elledge. I hope it's...
Prof, we are very correct. I agree. I totally agree with you. Usually, we don't normally use abstract alone to make a conclusion because it doesn't contain enough information. But there are some abstracts that may have some information. For instance, I'll give you an example. You know, there's some conference you attend. They will tell you to prepare your presentation ahead. You know, when you're doing the presentation, it's an abstract, but somehow it contains more information more than the abstract. And what happens is that those those conference will now publish that your presentation in the conference, which have more information. Those data the people need may be there. I used to encounter sometimes in one of my semester we have done in the past, whereby when you now download it, it leads you to the work. So it's not a full work, but the work the person finally presented in the conference, but it contains more detail of the result. Then the person now publish it. That detail is still there. Now, what the person is asking. But if you only abstract alone that contains 200 words, we don't normally include it. But there's some abstract that is that have more information. When the person now present it in a conference, and the conference decide to just put everything in their website, and when you're doing such, you get them. And in that case, you don't include, just include the one that is updated, that one that was published. Because if you include the two of them, it constitutes a duplicate publication. Because you are sure. How you know is check the registration number. If the clinical trial, Pan-African clinical trial is the same, you have to choose one because you can't include the two because it's not a duplicate. And also the number of authors. But he said that you now have maybe in the abstract level is a preliminary data. Maybe it's like what you normally do. Sometimes you are doing an RCT. A conference come up in 1 week, in a 1 week. You publish 20 you have. By the time you finish the work, it's now 100. You publish. So it's one that have more of the data you include, not the abstract, please. Because if you include both of them, it is a duplicate publication, which should be avoided in a systematic review. Thank you.
Thank you so much, Prof. We're top of the hour. Just to note, for the person that asked the question, when you write systematic reviews, that is why as Professor Ledger said, you explain in details what you did. If a systematic review used an abstract that the information is different from the systematic review where you use the full manuscript and the data is different, you have explained the issue. This individual had explained it was abstract and you have explained that it's manuscript. So of course, it might have effect if the figures are significantly different, but you have both explained what you did in details, and that doesn't have consequences. Thank you, Solomon, for your question. I can assure you that this is the tip of the iceberg. Professor Ledger, Kudus, and myself are running a systematic review, and this is the 7th month, and we're still at it. This question you've asked about context of fixed and randomized effect, it's a lot of answer for you to get, but that you have heard enables you know that there's a way around doing this. We'd like to thank Professor Ledger for being here. Thank you for the brilliant section. We thank you for coming on board, choosing to come on board, despite the fact that it was not convenient for you. Thank you, every one of you that is here. Just to note that you're going to take a break next week. And that next week is to allow those that are writing manuscripts to please get up to speed in terms of their manuscript up to the methodology session. For those writing the manuscript, please let's continue the conversation on the platform. On this note, Kudus, Toby, Professor Ledger, and myself are saying have a wonderful day. Bye, everyone. Thank you, Toby. We can check out now. Bye.